I spent the first 21 years of my life living in the heart of what would become known as the historic TCE plume on Tucson's Southside. I was drinking the tap water, and I remember the newspapers and television stations talking about it, and remember my family and I being confused about exactly what it meant for us and for our neighbors. You can imagine how scared folks felt when they heard that TCE could cause cancer. Some 20 to 30 years later, I know that still many folks have questions, concerns, and fears about the long-lasting impact about these exposures and others like 1,4-dioxane, which are only now being recognized. Today, I'm going to share with you some of the tools that we have to monitor the community's health and explains the limitations that make them imperfect to answer the health outcome questions related to the Superfund contamination site. Now, I need to start off by saying that these tools may not provide all the answers that we are looking for, and it certainly does not prove any one person wrong. In public health, however, we look at the health of populations and communities as a whole rather than individual persons. We look to see if a specific disease like cancer or birth defects are becoming more or less common. We can also compare whether a community that is getting sicker compared to its neighboring communities or not. The Arizona Department of Health Services and the Pima County Health Department collects information on cancer through a statewide monitoring program called the Arizona Cancer Registry. This program collects data to monitor disease rates across the state. It is how we know across Pima County the number of cases that are associated with this disease. Medical providers and doctors are required to report certain invasive cancers that are tracked by the Arizona Cancer Registry. We can look at the number of cases that occur in primary care areas, or PCAs. PCAs are the geographic portions of our community that have enough people to detect relatively rare disease events, like cancer. The Tucson South PCA includes the entire area that was affected by the TCE contamination, but it also includes other neighborhoods in the surrounding area. What we are not able to do is to know exactly what happens to individuals who live there at the time of the exposure, but may have moved to other locations since then. This data also requires doctors to report on who is sick and who is not. And so individuals must have received health care at a local health care institution in order to be picked up. People who moved away, received health care in other areas, or did not receive care will not be counted through this process. This is, however, the best information that we have, but you can begin to see how the information that we have is also limited. The current information that we have shows that the Tucson South primary care area has about the same number and rate of invasive cancers as do other primary care areas in Pima County or the rest of the state for that matter. This is true whether we look at a specific cancer like breast or colon, or whether we looked at all cancers lumped together. It's also true whether we look at just adult men, women, or children. The cancer rate for folks residing in Tucson South primary care area is not significantly different from the rate for other residents of the state of Arizona. Currently, we just do not see a significant signal that the community in the south side of Tucson experiences cancer at a higher rate than the rest of Pima County or the rest of the state. Does this mean that in a given case your cancer is not caused by exposure in the environment? No. What it means is that there's just not a large enough effect that we have been able to capture on a community level. It is true that chemicals like TCE and 1,4-dioxane have scientifically been shown to cause cancer in cell models, animals, and some limited human studies. But understand that in research settings, you can control every part of the environment. You and I live in the real world. So many things are not under our control and are not measured. That is why each person's risk of disease is unique. There are also other factors that put you at risk for getting sick. Having an unhealthy diet, smoking, being overweight, engaging in certain sexual behaviors, or living in an area of contamination. Sometimes a person does all the right things and still gets cancer as a result of random genetic events. For example, you and I know that smoking is linked to lung cancer, but we also know that there are plenty of people who smoke who never get cancer, and some individuals who may not smoke but still develop cancer. Today we understand that TCE can be linked to certain cancers, but we don't know for sure which of those individuals' cancers are linked to a specific contamination event. To fully understand the links of environmental exposure to disease, we will need to develop tools that are specifically crafted to answer our questions. I hope that we can continue to develop those questions and look for answers together as a community. But until that time, I will continue to drink the water that comes out of our taps, and I think you should too.